Well, January is Cervical Cancer Awareness Month, and I'm joined by Jenna Perkins, also known as Nurse Jenna Ray. She is the founder of DiscovHER Health. So, Jenna, welcome to Good Morning Washington.
Hello, thank you so much for having me. I'm so excited.
So, let's start by just talking about the prevalence of cervical cancer, because it's a lot more than I think a lot of us probably think or know.
Yeah, so in the U.S., we can estimate that about 4,000 women will die from cervical cancer every year. And it is something that is preventable. So I am trying my best to get the word out so that we can save lives.
So what are some of the things that can cause cervical cancer?
So the main thing is the human papillomavirus, or HPV.
Yes.
And that is a virus that is super prevalent. If you have had any sort of interaction with intimacy, then you have most likely come into contact with the HPV virus. It is very easily spread. But the good news is that the changes that happen that cause cervical cancer from HPV happen slowly over time. So if we are doing a good job of screening women for HPV and for these changes on the cervix, we can catch these cancers early, treat them, and prevent them from getting worse.
Which is the most important thing. And you know, we're talking about cervical cancer affecting women. Women, I feel like, notoriously are caring for everybody else. And I'm kind of speaking for myself right now because I have had, you know, like make an appointment, you know, with the GYN, you know, to get all the things done. And it's so important to do. And how often should we be going and getting checked up so that we can prevent potential cancer?
Yes, so you should be seeing your GYN provider every year.
Okay.
Once a year. So the guidelines for the actual pap smear, which is the swab that we take to get the sample from the cervix to detect cancer, those guidelines have changed. So we only have to do that every 3 years.
Oh, okay.
So every 3 years from the age of 21 to 29, we will actually take a sample from the cervix and send it off to the lab to see if you have these cervical cell changes. And then from 30 to 65, we can do every 5 years if we do also test for that human papilloma virus that we were talking about before.
So it really sounds like prevention is the key, and getting tested to make sure that you don't have the HPV or cancer.
Right, and again, assuming that if you've had any sort of sexual contact, you probably have come in contact with HPV, so you might have it, but again, we want to monitor it and make sure that it's not causing the changes that will lead to cancer. So most people have come in contact with HPV, but that does not mean that you will get cancer. It just means that you're at a higher risk.
Okay.
And I think it's important for us to note that the annual exam, so even if we're not doing the pap smear once a year, we should still be seeing our providers every year, because there are so many other things that we can talk about besides just cervical cancer.
No, and it's so true. And I see you've brought the little, I was like, I've seen that thing before. Let's talk a little bit. I mean, it's 2024. What are some of the advancements in technology that you're utilizing to diagnose and treat cervical cancer?
Yeah, so besides doing our normal pap smear, we have something called a colposcopy, which some women may have come into contact with. And what it is we use a microscope essentially to look at the cervix and to see these cell changes and to see if we need to do something about it. And the newest technology on the market, we actually have AI-guided colposcopes.
Oh.
So we can take all of the colposcopies that have been done by a bunch of providers in the past and look at the results, and AI will actually help guide providers to figure out where we should biopsy. Should we take a sample here?
Whoa.
Is this probably going to be healthy and normal, or is this concerning?
AI is, I mean,
it's everywhere.
It's really everywhere. So I know we've talked a lot about, you know, cervical cancer, but I want to talk a little bit about DiscovHER Health, because I went to the website. It is, I mean, just chock full of information. Tell us a little bit more about that and why you started it.
Yeah, so DiscovHER Health, DiscovHER, and the HER is for healthcare, education, and resources.
Oh, okay. So I just thought her because, you know,
yeah, because of her.
Okay.
Yep, definitely. But it came out of actually my experience in college. So I went to undergrad and I had a group of sorority sisters that would constantly be asking me about, you know, I have a yeast infection, or these questions, right, that you ask your friend who is the nurse.
Yep.
And so that seed was planted when I was in undergrad of, I really want to get the word out and help girls and help women to be able to have access to knowledge that I was getting during my, you know, educational years.
Exactly. Well, and especially with social media and TikTok, you know, you really want to make sure that you're getting your information from a reputable source. So Nurse Jenna Ray, thank you so much. You can see all of the information on the bottom of your screen. Discover Her Health for more. Thank you so much for your mission to raise awareness and hopefully keep all of us cancer free.
Yes, definitely.
Thank you so much.
For having me.